The at first patient in the UK has been purified in an innovative new radiation therapy car. The MR linear accelerator at once scans tumors within the flesh time supplying X-ray emission Perlin. It tool clinicians can schedule and regulate radiation therapy in actual period, enabling it to be more than exact rather than always up. They expect it will conduct to more than patient's creature healed time testing less party effects. Barry Darling, 65, who has prostate gland carcinoma, is the at first patient in the UK to be purified. Professor Uwe Erlf, who leads the collaborative MR linear accelerator draft at the ICR and Marsden, said me, 10 years ago we did not believe it would be probable to unite MRI and radiation therapy. The is a actual move change in technique. The car has been specifically intended so how the magnet coils of the MRI and the X-ray shaft of the line gas pedal do not hinder in every sum. It will be particularly helpful in treat tumors how change in amount and form in the flesh, such as in the lung, bubble and intestine. Dr. Alison Wood, advisor cancer specialist at the King Marsden, outlined the new technique as a vision go real how would allow clinicians to supply more than aim, high doses of emission, sparing wholesome fabric. In lung carcinoma, we would love to offer high doses of radiation therapy but are bounded since the tumor is frequently shut to some urgent structures in the trunk, she told. The allows us to see the carcinoma more than obviously and do certainly the emission goes wherever it is necessary and not wherever it can reason damage. The capacity to offer high doses of emission will allow patients to full their treat more than rapidly. MR Darling will include 20 sessions of radiation therapy in the MR linear accelerator. But he's forecasted how ultimately it will be probable to treatment several type of cancer in a solitary treat. The King Marsden will consider prostate gland, rectal, intestine, bubble, neck and ultimately lung carcinoma in the MR linear accelerator. Other car, at the Christie in Manchester, will start treat patients previous following year. So distant, the just some carcinoma centers to consider patients in the MR linear accelerator are in the Netherlands, in Utrecht and Amsterdam. The perspective of more than exactly aim radiation therapy, in less party effects, will necessarily indicate down there will be top consumer demand for accessing to treat in the MR linear accelerator. Dr. Wood told down there would be several clinic testing and precedents would be taking into account to study how received the largest gain to patients. Down there include been considerable improved in radiation therapy treat in latter year, it already contributes to 40% of all the cases of carcinoma how are healed.